Winter has arrived here in the Florida Panhandle, and let me tell you, it is scary cold, but maybe not as scary as what some Florida families are dealing with. On today's podcast, we're going to be talking about an entire subsection of families that have been denied access to medical care. And no, it's not Medicaid families. We're not even talking about the uninsured. We're talking about families who are seeking a primary care doctor that will allow their children to be vaccinated on a delayed schedule, or in some cases, to opt out of vaccines altogether. We're going to talk about, is it legal to discriminate against the unvaccinated here on today's podcast. So buckle up, because it's about to get scary.
Well, I'm a mom from Milton, Florida. I have 5 kids. This all started when my daughter was at her 2-month pediatrician appointment. It was time for her first set of shots, and I declined. And the doctor looked at me and said, well, it's your choice to kill your child. I won't have a part of it, and dismissed me from the practice. So I got up, I thanked him for his time, and I walked out. And I've spent the next 10 years, I have 5 kids in those 10 years, trying to find a pediatric office who will see my kids. And in that 10-year time, I've only been able to find one office that accepts insurance, specifically state insurance or Medicaid. And this office isn't even a normal office. It is a community health clinic that is a residency program where they're training their doctors. They will allow you to be seen, but there's no consistency. These doctors don't know you. They just get you in, they get you out, they move you on your way.
We were dismissed from a large practice here in Pensacola, Florida, for our medical freedom choice. It took us 9 years to find a family practitioner that took my insurance, but also their number one priority was my child.
Hi, I'm a mom from Bartow. I have 4 children, and I had just had my 4th baby, and we had taken him for his well baby visit into Lakeland. And the doctor noticed that my son didn't have any of his vaccinations. And he said, would you like to do those here? I said, I have some questions, maybe a delayed schedule. And he said, I'm going to stop you right there. Unfortunately, we cannot do that here. We'll have to discharge you guys from our practice. And we are still, to this day, looking for a doctor. We actually are going to have to travel an hour from where we live to go see another physician.
So you have just heard from patients across the state, mothers of children who are letting you know that in some cases they have tried for years to find a pediatrician that will accept them into their practice, and they are finding it extremely difficult, not because they have a complex patient, not because they don't have insurance. They cannot find a pediatrician who's willing to see a child who's either being vaccinated on a delayed schedule, or maybe they have parents that have legitimate questions about vaccines. My next guest is going to talk to me about this scenario. He is a doctor who is well respected in our community here in Northwest Florida. I've known Dr. Calvin Blunt for about 20 years. I don't know anyone who's ever had an unkind thing to say about this physician. I consider him a friend and a family doctor of the finest quality. I'd like to welcome to the show Dr. Calvin Blunt. Calvin, welcome.
Thank you, Joe. Appreciate it.
So, Dr. Blunt, we've talked about this before. There's a shortage of physicians out there who are willing to accept patients whose immunization schedule may not be up to date. Before we get started, because there's viewpoints on both sides of this, I just want people to know who we are. For example, I'm an MD. I graduated from Ole Miss Medical School. I did my training in family practice at Halifax Medical Center in Daytona Beach. Dr. Blunt, before we get started, would you mind letting everyone know your credentials?
Yeah, I'm family practice physician, and I went to LSU Medical School in Shreveport for medical school, and then attended UAB Huntsville for family practice residency, and then been here in Destin, Florida since 1998.
And the reason I want to mention this at the get go is because I want the viewers to understand, and I'll ask you the question as well. In Jackson, Mississippi, we saw patients from all walks of life. We saw the illiterate, we saw the indigent, we saw the drug addicts, we saw the prostitutes. At my training in Halifax Medical Center in Daytona Beach, we saw NASCAR drivers, we saw snowbirds, we saw business executives, we saw tourists. At no point in my training did any professor or did any doctor sit me down and say, look, if you ever encounter a patient who's questioning you strongly, or a patient who will not do exactly what you say to the letter, show them the door, discharge them. I never had that in my training. Maybe I missed the memo. Uh, did they say it was all right at LSU, or did they say it was all right at UAB just to throw patients out for disagreeing with you?
No, that's really kind of a foreign thought. We would discharge patients only if they were rude to the staff or inappropriate. But as far as their medical decisions, it's their body. That's really up to them. So it's hard for me to imagine discharging patients for that. We certainly would not do that.
Well, and that's what I think a lot of us, Dr. Blunt, are having a hard time coming to grips with, is the fact that like you mentioned, this is a foreign concept to us. I mean, there are legitimate reasons to not see a patient, or perhaps discharge one from your practice. I got to be honest, I've discharged a few, but probably no more than a dozen over a 20-year span. Again,
Yeah.
usually it has to be something really severe. Maybe a patient who has a gangrenous foot or something, and they've missed several appointments and they're not getting it taken care of. And so it'd be something like maybe a liability reason, or you mentioned someone um, threatening physical harm to you or your staff. So I guess my question is, where does this foreign concept come from? Do you have any thoughts on the topic?
Patients should have the right to decide what medical care they want, what they want to put in their body. So to discharge a patient because they're refusing a vaccination or a certain treatment or a medication, or if they had cancer and they refused the chemotherapy medicine, I mean, we wouldn't even think about discharging them. We're there to help them in whatever way we can, and it's really their decision for what type of medicine or what they want, to put in their body. That is really their decision, and I'm here just to support them and work with them the best I can.
And when you hear these testimonials come in across the state, and even on our Facebook, we're hearing from moms across the country.
Hmm.
When you hear these families, I mean, they're not ignorant. I mean, they're not unlearned. I mean, these are moms and dads doing their research, and they, in my opinion, have legitimate questions. And
Yeah.
I just don't know what's going on there. I mean, surely you've encountered people like that in your practice. How do you how do you approach those patients?
Patients that you mean that do not want to take the vaccinations?
Or patients that maybe come to you and they have a list of questions? Because again, most of the people I've encountered, it's not that they are necessarily dead set, but they want evidence that they're doing the right thing. What's the proper approach there?
Well, really, it's just really discussing their questions and answering it, to the best of your ability. Um, we certainly have not had any requirements, for someone to have a vaccination. As a matter of fact, I have not had any of the COVID vaccinations, and not only that, I've never recommended a COVID vaccine ever. Um, so, frankly, if they came and they had questions, I would happy to let them know what I think about it, my opinion, um, and really just try to have a discussion because we are there for the patient and to help them in whatever way we can to educate them and support them, and really not to demean them or threaten them to we're going to kick them out of the practice because they disagree with something that we want to do or don't do.
Well, and you bring up a good point. because you mentioned the COVID vaccine. I wonder if maybe that's where some of this heavy-handedness perhaps got started. Because,
Yeah.
prior to COVID, we had the usual vaccinations in our refrigerator at my office. You're talking about things like, tetanus shots, things of that nature, polio vaccines, and we would never
Hmm.
really get much pushback until the post-COVID world. Is it
Yeah.
possible that the questions people had about the COVID vaccine, maybe they now have further questions about some of these others?
Absolutely. That's no question. That's really when it all started. Before, I think people, well, it's just a totally different situation. When the COVID vaccine came out, to me, it it just didn't seem right. Something just seemed off to me, and that's when I really also started asking questions, and immediately, um, my guard was up, and um, I felt like the studies really weren't there, the proof really wasn't there, and it's really like there was an agenda, and they had a singular solution, which was the vaccination. Um, there were other treatments that were available for COVID, and the authorities were very aware of this. However, they were only able to get the vaccine approved under an pre-authorization, or what was the term? And if there were a treatment available, then they would not have been able to approve the vaccination. So they weren't allowed to have a treatment. And so some of this information, which they knew, they suppressed, and they frankly they lied about it. So when I heard all that, I knew something was going on, and I researched it quite a bit more. And the efficacy and the risk to benefit ratio just simply was not there. And so I decided not to take it and did not recommend it for any of my patients for a myriad of reasons.
Well,
Yeah.
and I'm glad you bring up these topics because as a doctor, you and I, we're trained to look at those sorts of parameters. We're trained to look at efficacy.
Hmm.
We're taught to weigh the risks against the benefits, and not just
Right.
COVID. I mean, I can point to other examples. So, you and I both lived through an era where we saw the very first shingles vaccine. Well, the first shingles shot that was in existence, I don't think you can get it anymore because when push came
Hmm.
to shove, the efficacy was only about 50%. So you're paying $500 or whatever it was for a shot that, it's a coin flip whether you're going to benefit or not. So there's the Gardasil vaccine that's out there, another very controversial vaccine. They're kind of pushing these on your youngsters. Um, so any thoughts on the vaccines themselves? Like I said, to me, some of them are a slam dunk, like a tetanus shot. I don't want tetanus. If a rabid dog bites me, I don't want rabies. So some of these vaccines to me seem reasonable. The research has been done. But when you start talking about Gardasil and Prevnar and and I wonder if that's the problem.
Yeah, I think you're right. I'm certainly not against the vaccines. I think vaccines have their place, and they're a valuable part of protecting us against disease and infectious disease, and even cancer. However, many of them have not really been adequately studied, truly studied, and they were put out there under kind of this authoritarian sense that these are for your benefit, and you must take these and don't question them. But I think people are questioning the vaccine, really questioning everything now, medications, pharmaceuticals. People are really waking up and questioning what's the real truth and the real benefits. Um, and the fact is that many of the ingredients that they're putting in the vaccines, there's lots of questions about are there risks that we're really not being told. And you're right, the number of vaccines has just gone up tremendously. Um, and in my mind, the vaccine manufacturers at this point simply can't be trusted. And I think we need a thorough review, a real rigorous review of all the vaccines, and reevaluate this the whole schedule.
Well, and we talk about things like efficacy. We talk about the sheer amount of these vaccines that's being offered nowadays. I
Hmm.
mean, there's a rotavirus vaccine now. Rotavirus is basically the stomach flu. It's a stomach flu. Um, so again,
Yeah.
sometimes you're talking about vaccines for things that aren't necessarily deadly. Uh, that certainly undermines our argument as doctors. When we're trying to get somebody to get a tetanus shot, and instead we got to explain why there's 50 different vaccines on the market. I'm wondering if, the pharmaceutical companies and, like you say, the big corporate practices, I wonder if that serves to undermine our argument as well. The fact that maybe a lot of our colleagues work for corporations. You and I are in private practice, and so, we're under no pressure
Yeah.
from outside sources. We're honest with our patients. I wonder if some of our colleagues are maybe employed in a situation where if they don't toe the line, maybe their job is at risk. Have you heard from any colleagues? Do you have any sense that that might also be happening?
Well, I know that for 100% that is happening. I have friends that are local physicians here that work for big organizations, and they had different thoughts. As a matter of fact, they um, themselves and for their own children, some of their phys- some the, personally spoke to one of their physicians during COVID, and he was against for his family and himself getting the COVID vaccination, and even recommending it for his patients. But he was not allowed. He would have been fired by the organization had he refused the vaccine
Mm,
himself,
mm.
and had he not recommended this to his patients. So yeah, it's a blessing that you and I, we get to we're free in that regard. We can tell our patients honestly what we think. Um, so yeah, there's definitely that component for sure.
And then, the final point, Dr. Blunt, that I want to bring up with you, you mentioned it in your very first words. You talked about how, patients always reserve the right to choose what they want.
Right.
I mean, we don't live in a world where you can force someone to take chemotherapy. We don't live in a world where
Hmm.
if someone's sitting there, having a heart attack in the emergency room, you can't strap them to the table. He has the right, he or she can sign out against medical advice if they want. So
Yeah.
I wonder how much of this as well, in addition to undermining, you know, veteran doctors like you and I, in addition to undermining us by putting so many out there, they even nowadays they let pharmacists give these things. So that's another way they undermine
Hmm.
physicians like you and I. I wonder if there's also the argument to be made that maybe there's a new generation of teaching that's coming out. Maybe some of our younger colleagues don't realize, hey, it's never been this way. This authoritarian approach to medicine, this is not the Hippocratic Oath. This is not
Yeah.
how we were trained. And so I wonder, are we missing that part in medical training? Are they not stressing the fact that patients always reserve the right to disagree? And again, since you brought it up in your very first sentence, I'd love to hear your thoughts on patient freedom and the right, like you say, to go along with the treatment, to disagree with the treatment, because to my memory, I can't think of a single patient that I've let's say I tell them they need Lipitor for their cholesterol and they disagree. I don't throw them out,
Hmm.
Dr. Blunt. I say, "Okay, well, we'll check another level in 3 months." And so, I'd love to hear your thoughts on patient freedom, and we'll end it there.
Sure. Yeah. I mean, the statement, "It's my body, my choice." I certainly agree with that. Some people use that when it's convenient for them, and not when it's not. But um, you're right. I mean, people are sovereign over their own body and their health, and what goes into their body. And with that freedom, it's truly their choice, 100%. So my viewpoint, I go in. I tell patients, I'll be a partner in your health, and let's go through this together. The other slightly side of this is, for one thing that we do is we really look much more into natural means. Are you getting, is your vitamin D level adequate, which does help to support your immune system. Um, when you get a virus, adding things like zinc and vitamin C and vitamin D, um, getting adequate rest, cutting back sugar. There's a lot of other things you can do that's not pharmaceutical or vaccines. And people are waking up and people are wanting this type of medicine, things that really to empower them. So things that people can learn how to do and treat themselves and not really even be as reliant on the physicians or the medical system. So we definitely have gone that route. And there's many natural things out there. And there's also medications for some of these viruses that aren't commonly used that that we use and should be known. And they're actually very effective. So and I can tell you, the patients that we see coming in, this is exactly what they want. They want alternatives, and they don't want things crammed down their throat, and they want things to be explained to them, and they want to be involved in their own medical care and what goes into their body. And we support that fully. And patients respond to that tremendously well. Our patients are very loyal and very thankful that we have that attitude.
And I totally agree with every word you said. You know, the way I approach it,
Yeah.
if someone comes into my office and let's say it's a cancer diagnosis, or let's say, yeah, I've got to
Hmm.
put them on blood pressure medicine, or maybe it is a vaccination visit. The way I see it, Dr. Blunt, it's my job to make a compelling argument for someone to put a foreign object, a foreign substance into their body.
Hmm.
And if I can't make that
Yes.
argument, you know, again, maybe it goes back to some of the new age training that's happening in medical school. Perhaps it goes back to the fact that we have so many people in Florida who are practicing who never once set foot in medical school. You know, I don't know where it comes from, but the point is,
Hmm.
if you can't make a compelling argument why a patient should do something, they're probably not going to do it. And again, I think that's only right. If I want to put someone on an ACE inhibitor for their blood pressure and I can't explain to them what an
Hmm.
ACE inhibitor is and how it works and how that benefits them, well, you know, they're going to be skeptical. And to be perfectly honest, I don't blame them one bit in this day and age. So, Dr. Blunt, I tell you what,
Yeah.
if an LSU doctor and an Ole Miss doctor can agree on the same thing, man, it must be pretty common sensible if we can both come together as SEC rivals. But listen, I want you to know how much we
Yeah.
appreciate you here in the Florida Panhandle, and keep fighting for your patients.
All right. Thank you, Joe. Appreciate it.
So, me and my family moved here from Kansas in 2020 during the COVID crisis. And I had to get my 5-year-old uh, a physical for school. So, I went to White Wilson, um, and they, on my first visit, basically told me that they wouldn't see me because my daughter was missing one vaccine, the varicella chickenpox vaccine. And I told the doctor I moved halfway across the country to the free state of Florida so that I could make choices for my children. Um, Luckily, there was another doctor in that practice that was able to see us. But my doctor in Kansas said that varicella was one that it would be better if she got chickenpox naturally. But yes, so we were refused service by that particular doctor. I believe he's still in practice today. And it's very unfortunate that doctors are out there and do this to parents and put them in a situation where they're pitting, care against their children.
So I was born and raised in Pensacola. I have 4 children, and we did move to the Midwest, actually to Kansas, a few years ago. But prior to moving, finding providers that would accept my decision to not vaccinate was very difficult. I was denied by 3 providers until I finally found a wonderful provider in Pensacola who agreed and understood and, didn't make me feel guilty. My children at the time were exempt from vaccinations. I had to obtain that exemption from the health department, where I had to undergo counseling and what I felt was pretty much gaslighting and bullying as to why I was choosing to be exempt from vaccinations. I'm a very strong believer that your body, if given the proper nutrition and diet, the immune system can do exactly what it's supposed to do, and you don't need toxins in your body to fight common viruses. Um, I was extremely concerned for my youngest son, who is now 15. He presented his whole life with being immune compromised or immune deficient, just wasn't sure, and again was gaslighted by doctors saying nothing was wrong. And he did receive one vaccine in his life, and that was the RSV virus, the RSV vaccine when he was an infant. And within hours, he had a very bad reaction, throat swelling, asthma attack. And so that was when I just stuck to my guns, but continued to be denied, by these providers, even though I expressed my concern. Fast forward to we're now living in the Midwest. We now know that my son is very medically complex and has multiple things going on with him, and he is not a candidate for vaccines in any way. And this has actually been a reason for my husband and I, who our parents are there, our family is in the Panhandle, but we have chosen not to move back because we can't risk finding or not finding doctors who support and understand that our son is not a candidate.
More heartbreaking stories from actual families in Florida that are being affected adversely by this nonsensical policy that these pediatricians are pushing. They are literally throwing pediatric patients out on the street. You heard a story of a mom whose family was entirely vaccinated except for one child, and they were just missing one vaccine, and they were shown the door. You heard a mom who just wanted to slow roll the vaccines and had been slow rolling them at a previous doctor, shown the door by her new doctor. I now want to turn the podcast over to two esteemed guests. I'd like to first introduce PG Schaefer. She is a registered nurse for 42 years. She is the nurse director for the community pregnancy centers clinics. Of Gainesville. More importantly, or as importantly, she is also the Marion County Republican State Committee woman. I'd also like to welcome to the show Nurse Nicole, also a registered nurse for 20 years. She is known across Florida as a medical freedom advocate. Ladies, thank you so much for joining the podcast.
Very glad to be here. Thank you.
Happy to be here.
Nicole, I'm going to start with you. What do you think of these stories we're hearing of parents who are being shown the door when they're trying their best to comply? I mean, in some cases, they just have questions. Are you hearing this a lot across the state?
Unfortunately, we are, Joel. This is something that's more common than people want to talk about. It's a lack of informed consent that's being given because, at this point, the parents have more questions. They're not feeling comfortable. They're trying to elaborate on what is necessarily supposed to be given. Why is it being given? And instead of providing that informed consent and continuing to build that, patient, physician, directed relationship, these families are being turned away. And I feel like it's completely unethical. It's inappropriate. We took an oath to do no harm, and those children need somebody to be able to look after them. So it's more common. We have a lot of individuals that are saying this and why it's so important that it's being discussed in legislation.
Well, and PG, I think you might even have a personal story dealing with this exact same topic. Is there something you'd like to maybe share with our viewers?
Absolutely. So, as you can imagine, as a nurse for 42 years, I've got grown children. And so my story is not personal to me as a mom, but to me as a Mimi. I have two grandbabies. My daughter's a healthcare professional. She has her doctorate in physical therapy, and her youngest was born. He'll be 3 on Valentine's Day. And in the preparation, when she was pregnant and searching for a pediatrician, they live in Polk County, and searching in the area for a pediatrician. And no one, when she and her husband expressed that they would not be vaccinating, they were told, but in no uncertain terms, you will not be able to do that. You will not be able to do that in this practice. Not even delay. No one would even allow to delay. Or there might have been one that would delay, but by X date, X age or whatever, they had to be caught up, or you'd be dismissed from the practice. So, as a new mom, soon to be new mom, she couldn't find a pediatrician for her baby, and has to drive now 45 minutes to a pediatrician in Winter Haven to get care. Now, I believe there's a family practice, but she specifically wanted a pediatrician, someone expert in the care of babies and children. And there were no pediatric practices in the area that she in the city of Lakeland. Well, I'll just say it, the city of Lakeland. She's and still in Polk County. She found a pediatrician that she is comfortable with and dearly loves, and he's wonderful. But she has to drive. She does have to drive, and he doesn't practice in Lakeland. He doesn't. If her baby's sick, the baby they would have to go to the hospital in Winter Haven where he practices.
Well, and this is just insane. I mean, I can't believe we're in the free state of Florida talking about these instances. And just so both of you know, and I'm sure you know as registered nurses, this isn't the way that we doctors are trained. I mean, my guest earlier on in the podcast, he was trained at LSU. I was trained at Ole Miss. Uh, when we're in medical school and doing our residency training, we work in the inner city, right? There is no continuity of care. Every child we see is on a delayed catch-up schedule. There is no, hey, this child isn't doing what I'm saying. Throw them out of here. I mean, that's just not how we are told to practice medicine. So, Nurse Nicole, I'm going to go back to you. Y'all have had a lot of time to think about this. Any clues or any concerns about where this philosophy came from? Because it's totally foreign to
Mm.
people like me and PG. It's totally foreign to people who have been doing this for a long time.
Well, I mean, one can speculate at this point. I mean, I think it's progressed over the years. There's a lot of information going out saying that this is a public health safety concern, that if children are not vaccinated, that there can be problems in our communities and these diseases can, arise and cause problems, which we all know that injecting yourself with the vaccine that is not necessarily safe or effective. That does not necessarily prevent transmission, as evidenced by we don't have any safety studies that prove through a true placebo that in fact these are what they say they are. I believe that it's an incentive to continue to push the narrative that that is what they consider public health, which is truly just vaccination, and really putting parents, pigeonholing them into believing that that is the only option. Because for those that may not know, we do have medical and religious exemptions in the state of Florida. However, 9 times out of 10, many parents will tell you that they are never offered to them. They are never discussed in the pediatrician's offices. They are never told when it comes to starting school or playing sports or going to college that there are things in place that if they don't feel comfortable, that they can potentially opt out if the information provided to them is not something that they're comfortable with. So to me, it's hard to really justify and it not come off kind of nefarious when we have all these things happening and pediatricians have the capability to sit down and really educate and give this informed consent, but also the right to bodily sovereignty or the right to have autonomy over what a parent does with their child and not face possible discrimination, which is what it is. For those of you that are listening, it's discrimination no matter how you want to talk about it. Denying care due to vaccination status is discrimination. And then taking it a step further, that those pediatricians are not liable if something was to happen, if a child was to receive a vaccine and have an injury, because there's protections in place. There's a shield liability to all manufacturing companies, and the only resolution is possibly suing the federal government. Again, a lot of things that the parents are not told. So when these things are being told to them and saying that this is the only way that they can move forward, being a productive member of society, going to daycare, going to school, playing sports, etc. These parents feel that, these individuals in these white coats are to be trusted. And that has evolved over the years. And I think it's due to the fact that there's a lot of, hesitation, the fact that we saw what happened during the pandemic. It's really amplifying. And there's a lot of things right now that are really trying to push that that is the only way that we can keep each other safe is strictly vaccination, which most people who are in this understand that that is not true. There are other ways to do this. And all of these diseases are treatable. We're not in a third world country. We have access to health care and should not be forced or coerced on parents who have these teeny tiny little babies and children that are concerned, and rightfully so, what could happen as we've seen a rise in autism across the board, in addition to a lots of vaccine injuries, whether they know it's a vaccine injury or not. So there definitely is room for this conversation. Physicians, healthcare providers should be open to having that. And if they could educate themselves a little bit more and be willing to meet those parents in the middle, I think we would have a better outcome and parents would be able to make better informed decisions.
Well, and Nicole, to your point, that education, that discussing the risks and benefits with the patient, it's just not happening in a lot of pediatricians' offices. And of course, as a family doctor, you know, I see forms for a lot of different patients. Like, for example, I'll see people who are deployed in the military who are going to, let's say, North Korea. And so it may be in their best interest as a DOD member or as a soldier to have a certain vaccine. But then I'll go in the next room and I'll have a patient go to the University of West Florida as an 18-year-old college student, and I don't know if y'all have ever been to the beautiful campus of UWF. It's very spread out. I mean, you can throw a rock and not hit anyone, but on their entrance form, it will say meningitis vaccine suggested. And I have to educate that young teenager. Well, I mean, you can get it if you want, but what are the odds of you getting bacterial meningitis? And understand this shot doesn't protect you against all cases of meningitis, just from this one organism. So I definitely agree with you that the education is not happening. And then, of course, the other thing that's happening, and PG, this question is for you. You know, what's happening is they're complicating matters by throwing in all these new vaccines that are just kind of muddying the water. So while I can make an argument, PG, that a person might need a tetanus shot if they step on a rusty nail, I can make the compelling argument that if a rabid dog bites you, you may want that rabies vaccine. How do you make a compelling argument for rotavirus? How do you make a compelling argument for a shot that's supposed to decrease your incidence of an ear infection, which isn't going to kill you in the first place? PG, what's happened to the vaccine schedule? How many of them are they pushing now?
I think it's around 72 between birth and
Geez.
18. And how do you justify a vaccine for a sexually transmitted infection or an infection from sharing dirty needles with IV drug abusers, also known as Hep B, to a brand new, hours old newborn infant that may weigh between 5 and 12, 13, 14 pounds. And Nicole is a nurse, and you, Doc, you know that most of the medications we give are the dose is dependent on body weight. Do you know that vaccines, the same dose given to a 14-pound newborn is given to a 5-pound newborn? And that baby is not exposed unless the mothers be positive, and that they're always tested. So why the push? Why the push for that? Why so many? Things like COVID opened my eyes.
Well,
COVID
and
opened
PG,
my eyes.
I think it opened all of our eyes because, I'm one of those family doctors. I've got the refrigerator in the back room. I've got the freezer in the back room. So on my super bill, you could see, the place to check, where I've given a polio shot, where I've given an MMR. But the demand for the vaccines has really just precipitously just kind of fallen off the cliff ever since the COVID debacle. And so I want to throw this out there and get both of your opinions on this. So you'll hear mothers also say, we have one mother who went on record saying that their pediatrician told them point blank, "This hurts my bottom line. If you don't get vaccinated, it hurts my bottom line." Now let's be clear about one thing. As a solo family doctor, with me in my refrigerator and Dr. Calvin Blunt earlier, with his solo practice, when you're in solo practice and you give, let's say, a tetanus shot, you lose money on every tetanus shot you give. So a guy like me, hey, I'm not going to force something down your throat if you don't want it, right? There is no extra incentive. But I wanted to ask the both of you. It seems to me like most of these doctors that are pushing the vaccines, they are corporate employees. They are not individuals. They work for these large conglomerates, these large practices. And of course, y'all know as registered nurses, what happens in those settings is they do not eat what they kill. Their salary is not how many patients can you see. Their salary is based on bonus structures, and it very well may say in their contract, you don't get your bonus unless 80% of people are vaccinated. Nurse Nicole, do you have any knowledge of that, or can you maybe shed some light, based on your years of experience? Is it more the corporate types that are pushing it, or is it more the pediatricians rather than family doctors? What are you seeing?
Doc, I can pick up if while
Okay,
she's
go
getting
ahead,
herself
PG.
together. I was just going to say, the Vaccine Childhood Injury Protection Act, 1986, that Reagan signed into law. Um, that is when vaccinations exploded. They had the manufacturers were and the physicians giving vaccines are completely indemnified against liability. The roadway was wide open, and they just started pounding the schedule and pounding the schedule, and that's how we've gotten to 72 vaccines. I mean, back in when my kids were little, they didn't really encourage flu shots necessarily. Children are resilient; they recover so well from viral illnesses, but all of a sudden they started pushing flu shots. So I think that had a lot to do with it. And that's one thing we definitely need to change.
Nurse Nicole, what are your thoughts on the topic? Who's pushing these shots and why?
Yeah, I think because there's two sides of this, right? There's a lot of pediatricians that do work in lots of corporation type settings, and they do have a certain percentage that they're told that they have to meet for vaccination, or they can lose their incentives and their bonuses. So a lot of times they're highly discouraged in taking those parents that are not going to vaccinate, even those that want to delay. There's an issue with that. So they don't want to take the risk, and they automatically just say, listen, our practice is no longer going to see you. In addition to the insurance companies that really are coming down on focusing on protocols, right? They're not really trying to give the physician the opportunity to actually practice patient specific care, whole care. They're just pushing these protocols, and they're being told what to do based on these guidelines that might not necessarily actually benefit the specific individual that they're trying to treat. So I think there's a combination of things, but ultimately, pediatricians are really hitting this hard on that side because I have friends in family practice and nurse practitioners. They don't make money off of this. It's specifically the pediatric groups that are being dictated by insurance companies that really are affected the most.
And the American Academy of Pediatrics that
Yes,
pushes it, and Big Pharma that owns every medical program in this country.
Well,
exactly. And
a and on that note, I want people to know that, we've been talking about what sounds like a dire situation. You wonder who can you trust, and if you're one of these moms that we heard from, you're thinking, well, who do I go to? Who's going to care for my child? Like I said, we've had children who were fully vaccinated except for one varicella shot. And these children were shown the door by pediatricians here in the free state of Florida. So I want these mothers to know, ladies, that help is on the way in some form. I invited you both on the show because you guys follow what happens in Tallahassee very closely, as I do. I'm keeping my eye on a House Bill 917, that was filed by a good friend of mine, colleague Jeff Holcomb out of Central Florida. And, looking at House Bill 917, I can tell you that there is some language in there that at first, I got to be honest, the language is a little scary. It talks about discrimination protections for people who are unvaccinated. And as a Republican, I don't like making carve outs for anybody. I want people to stand and fall on their own merit. But when I hear stories across the state of people just blatantly being discriminated against, I can't help but think that something must be done. In my opinion, ladies, what we're seeing when we talk about the unvaccinated, these are the same COVID tyrants. They've just changed their tactics. Instead of pushing the COVID vaccine on you, well, now they're going to push, you must do what I say. It may not be the COVID vaccine, but it'll be this vaccine, or it'll be this demand, or your child must weigh this, or I'm calling DCF. So I'm following House Bill 917. Anybody want to weigh in on what's in that bill, and any good things, any bad things that you see about it?
so, do you want to go ahead, PG?
Well, I was just going to say, we were trying to remember where we've worked on stuff before legislatively, Dr. Rudman, and there's a little statute we're off that I know you're familiar with, 381.00315.
Yes.
And that statute needs to be complete repeal of that statute. The two bills, 917 and SB 1756, there's a little piece where it takes out the thing that says you can be mandatorily vaccinated. So the
Mm.
whole thing needs to be repealed, but there's a little piece in both about that.
And
Yeah.
Nurse Nicole, I'm not sure if you're familiar with my history. So I was in the state legislature in 22. Well, I was elected in 22. I was there 23 and 24. My bill was we called it the medical emergency bill. So a lot of the language that's in the Senate version, the Clay Yarborough version, 1756, a lot of that language is old. Uh, the
Mm-hmm.
purpose of my House bill 2 years ago, I wanted to make it where your executive branch could never lock you down ever again and could never forcibly vaccinate you. Now, of course, things often look different in the Senate than in the House. What's in this new Senate version, and do you share those same concerns?
Well, I also was part of some groups back in 2022, 2023 that was trying to get some of those bills, the SB 222 with Health Freedom Florida, to try to take some of this verbiage that we're seeing in these bills and apply it back then. So, currently with SB 1756, we have the philosophical exemption that's being added. This is kind of appealing to people who don't fit the mold for a medical or religious exemption. So I can see where that has its benefit. They're also talking about informed consent and making sure that we enhance that so that individuals, meaning more so parents, are told what exactly is going on. I think it went as far as to even require signatures to show that they were in fact
Yes.
aware before things could move forward. The other
Yes.
thing was, the over the counter ivermectin, which, other states have done. This is really popular. This is a big thing that people want to be able to have access to. Of course, there's some things in there that talk about the pharmacist and, like who's going to be liable and all the things. So we're working that out. And then lastly, the part that we were missing huge in both of these bills was the all vaccine mandate verbiage that never made it. So
That's what's missing.
we're missing those big time, and the medical freedom groups are constantly, and we're in up in arms right now fighting that. So there are some things, I'm going to say this kindly, I call them breadcrumbs. These are breadcrumbs in the bill that I think are great, but there could be some more robust things behind it. I feel as if, and I can say most of the medical freedom groups are more leaning towards the House bill 917 based on its verbiage and some of the other things in there as well. But as PG said, there are some things in there when it comes to forced quarantine, forced isolation, forced treatment that is not new, but was added into this bill. The nuance or the addition was that they have added you cannot force vaccinate during those times. So that was something that was added to specify in there as well, that some people are grasping at that. So, you know, I have some strong opinions about these bills because the main parts to them were completely gutted when they were filed. So that's where we're
Yes.
at right now in Florida.
I totally agree with Nicole. The
Yeah.
whole medical freedom aspect of it. God bless these two legislators for filing them and pushing it, because I will tell you, I watched Senate Health Policy, and Senator Yarborough got completely, I mean, he
Yes.
was ripped from stem to stern.
Same.
They ripped him
Mm.
up, and he did a great job,
He
but
did.
they tried to gut even what the shell of it that is left, where
Yep.
they tried to even gut further.
And the thing, Joel, just really quick, people need to understand that we're not trying to take the right away from individuals to vaccinate. It is saying that we're not doing this on a mass scale, right? Because we saw what happened during the pandemic. When you mass force vaccinate or coerce others to feel that they have no other option and push these products that a lot of times are not, specific risk versus benefit. There's a lot of things that may not pertain to these individuals who are being forced to feel like they have to get it, or they can't go to the movies, or they can't travel, go to school, etc. Even as a nurse, I still have mandates in Florida that most of our legislators are completely unaware of, and we're subjected to other things as well. But with that being said, when you mass vaccinate and you don't have programs or things in place to help these individuals when something goes wrong, when there are harm, when there is death, when there's something that happens because there is a VICP, there are things in place because of what happens when we vaccinate. There are risks. Read the inserts. That is where we want our state legislators to understand that this does not remove the right to still vaccinate as you wish. It is to decrease the risk for those who may not fit the mold, because where there is risk, there must be choice. Medicine is not a one size fits all, and they have to
Correct.
allow the patient relationship and the parents to make the right decision between their health caregiver and themselves. Because at the end of the day, once those vaccines are given, there is no one left behind to handle what could be. There is none, because there's no one held liable. So this is where our legislators need to understand how important this is, to be able to still have the choice.
Well, and I'm sorry to hear the treatment that was afforded to Senator Yarborough. That was like I said, that was my partner in the
Yes.
Senate for 2 years when it came to medical freedom and medical conscience and restricting these forced vaccinations. But I did hear one thing about that Senate hearing where they wanted to water it down even further, and y'all may have mentioned there was an amendment that failed,
Harold's.
and this
Yeah,
often
Harold had
happens
three
in this.
amendments.
Yeah, and it often happens in the
Hmm.
Senate, right? Y'all have heard the old adage, the Senate is where good bills go to die, and Lord knows about a dozen of my bills died in the Senate in 2 years. So there was this
My
amendment,
baby box
just
bill died 5 times.
so just understand, everybody, that as a former legislator, my idea of a good bill, if you can't summarize it in 7 pages, it's not a good bill, right? If you gotta take apart this statute, or I gotta define this or that. So a lot of times these amendments, they just bog us down even further. Like, I think you might have referenced the amendment actually that was defeated. They wanted a doctor like me, if a patient did come in and refuse, let's say, a tetanus shot, I would have to have them sign a waiver and sit there and spend 30 minutes educating. Look, you know, now you're making me liable. You're making this my. I've always approached
Exactly.
medicine as if I am your advisor. You can do what I say, you cannot do what I say. But if you're going to create mountains of paperwork for me, if you're going to create a whole new bureaucracy for me, right now we see those patients every day in my clinic. And you know what? It's no big deal because we understand as doctors, look, they know the risk. It's inherent, right?
Right.
What's going to be next? Is the Florida Senate going to make me sit people down and explain their Z-Pack to them or explain their cough medicine to them? I mean, give me a break. That amendment, I think it was intended to water this thing down. I think it was intended to turn doctors against the bill. But, like I said earlier, if you're asking me which one I prefer 917, specifically because
I
of the
think I agree.
language. Yeah, specifically
Right.
because of the language that helps these poor families that are without doctors right now. But give me y'all's opinion because y'all have been through this before. Y'all are very well respected in Tallahassee. This isn't your first rodeo. PG, what do you think the odds are of these bills making it through the process? And what do the viewers out there need to do to make this more likely to happen? Oh, don't give me the big
Sadly,
zero on these bills.
I the way I
What?
saw them react in the Senate, and like you said, the Senate is where good bills got to die. My poor baby box bill died there 5 times until it finally passed last year. And they just really, it's already been gutted. It's already been gutted, and they wanted to gut it further. And Harold's amendment that failed was she wanted the same thing to be to the ones that choose not to vaccinate to have to go through the counseling and education and all that. And the whole point of the counseling and the signing of the forms and that you've been educated on the vaccine, that's called informed consent.
Right.
That's called informed consent. You're getting a medical product injected into your body, and once it's ejected, or your child's body, it can't come out. It's there forever, and so you need to be educated. You need to sign that you're educated. That's informed consent. As medical professionals, we understand informed consent. You don't need to consent to decline something, right? I don't need to,
Absolutely.
consent and sign a paper, and you sign a paper that says that I declined. That's absurd. But
It's like
that's what
it's
she
like
wanted to
it's
add.
like going to it's like going to view a house to buy and you decide not to buy it, but they want you to sign the paperwork anyway because you're agreeing not to buy the house. It's crazy. But
Right. Crazy.
Nurse Nicole, let me ask you, Nurse Nicole, because from what I'm hearing from my sources in Tallahassee, the holdup is the House, unfortunately, and the House is usually more conservative. And so, from
Yes.
what I'm hearing, the bill is
Yes.
stuck in its very first committee. It's Chairperson
Yes.
Kaylee Tuck, who's a good friend of mine, and
Yes.
who's usually pretty reasonable. She's a good representative and a good leader. Uh, any
Yes.
advice for our viewers out there? What should they do to let Chairwoman Tuck know that this bill needs to be heard?
I love it. So currently, we are posting calls to action on Florida Children's Health Defense, Stand for Health Freedom, Global Wellness Forum. Large medical freedom groups are posting and tagging Kaylee Tuck and Daniel Perez to let them know that it is extremely important that HB 917 be brought and scheduled to discuss this bill because currently it's not on the schedule. If any of those groups resonate with you, we highly encourage you guys to follow us on social media, sign up for our newsletters We're constantly trying to engage the public and what to do, how to email your senators, call the senators, the House representatives, really get engaged with those individuals. I will do that shortly this afternoon, repost some of those that we posted earlier and tag some of the other House members that we are trying to specifically target to please, please, please understand what this means for medical freedom. I just really hope people understand that the common thing that I get as a nurse is, this doesn't have anything to do with me. This doesn't affect me. I'm not in a job that requires a vaccine. I don't have children that need vaccines anymore. Why do I need to really push for this? The thing is, we already have a very broken healthcare system, and too many people are being subjected to things that are not appropriate. And we want people to understand that just because it doesn't affect you directly now does not mean that it won't. Because when things start spiraling, like Joel said, what is the likelihood that they're going to come back like they did in healthcare? First, it was COVID, then it was the flu vaccine, then it was like we're constantly switching the narrative based on what's happening. We don't want that for you and your family, so that when you say that it doesn't have anything to do with you, and then a year later they tell you you can't go out of your 15-minute city unless you have a passport to show that you've been vaccinated. We need people to understand this will eventually come to you. So please join us, those
This
medical
girl
freedom
gets
groups.
it.
We don't have enough time on the show. I have so much stuff, but basically
Girl, we gotta
very
talk.
very grateful because Joel knows we are out there. It's just getting access to these legislators and understanding you represent the people. These people are counting on you. These communities spread wide and far, and it's so important that we're not even talking about the injured that I work with. I work as a medical vaccine injury advocate. These people are struggling. They have no resources, not even being recognized. We're trying to prevent more people possibly becoming like them by allowing these bills to go through, to have more choice, to be able to make decisions and be able to still go through society and not be shunned. I received death threats as a nurse during the pandemic because I didn't vaccinate. Like, people need to understand the severity of it. And it spans not just for COVID-19 and flu, but childhood vaccines. These are our babies. I have small children.
Absolutely.
I want to protect them. So this is very
Absolutely.
important. So yes, thank you, Joel, for having us on and letting us be able to talk about some of this.
Well, thank you. And now PG, because Marion County is near and dear to me, it's like my second home. They really kind of took me to heart when I was in the legislature, and so I love your citizens in Marion County and Ocala. So I'm gonna let you take us out. You have the last minute. I'm telling you, give us the last word on this, PG.
Uh, Nicole is right. We have just scratched the surface. There's so much more work to be done. And, she's on the one end of the age spectrum with little babies, and I'm on the other end of the spectrum. And we have got to work together and be able to produce success in achieving medical freedom. I mean, we call ourselves a free state of Florida, but are we really? I
Well,
mean,
I tell you what,
we have
that's
so much work to be done.
I think
I
you hit
wish
the
we
nail
were,
right
but
on the head. And and just before I say goodbye, when I did have my medical emergencies bill before the House, you know, it got one hearing in 2 years. And I was told that the one hearing it did receive was as a favor to Senator Yarborough. Ladies, the state of Florida, the moms that I've talked to, they don't need any favors. They need help. So thank you
amen.
for coming on and
Yeah.
thank you for bringing this to light. Thank you, ladies.
Thank you.
I'd like to thank all of our guests for participating in this very thought provoking and informative podcast this week, particularly the moms who recorded testimonials that we used in this podcast. And again, just to drive the point home, uh, we are not anti vax. I personally am not anti vax. I've been fully vaccinated. My children have been vaccinated. I took the COVID vaccine. I keep vaccines in my refrigerator and freezer in my office, and we administer those to patients who choose to be vaccinated. So, again, this isn't about the rights or the wrongs of vaccines, whether you need them or not. This is about your choice. This is about your right to choose whether you accept a vaccination from my office or from another doctor. I'd like to thank those other freedom fighters who are speaking out in the state of Florida as well, particularly Surgeon General Joe Ladapo, as well as First Lady Casey DeSantis. Thank you for bringing attention to this important topic. And you know what? It's somewhat interesting that this overlaps with the current Australian Open, where you have another freedom fighter, Novak Djokovic, arguably the greatest tennis player of all time. He holds a record-setting 24 Grand Slam titles, and he would have even more if not for the COVID debacle back in the 2020s, where he was literally deported from Australia. He was discriminated against. This is medical discrimination at its heart. This is what it looks like when you have someone who's healthy and they are denied service for an illness or an injury. And what was Novak's crime back in the early 2020s? Why was he sent home from Australia? The world's greatest athlete, perhaps the most perfect physical specimen in his sport? Well, this gentleman was deemed a health risk. And what was his crime? He chose to be unvaccinated. Well, listen, I've got to get inside. It's freezing out here in the Florida Panhandle. It's about 20-something degrees, as you can tell from my outfit. It's really cold. But I tell you what, let's pledge to change things in the state of Florida. Let's pledge to not leave all these moms and their semi-vaccinated, or in some cases unvaccinated children. Let's pledge not to leave them out in the cold.
My name is Kayla, and my location was Oviedo, Florida. I have two sons, ages 7 and 6. In 2018, Interlaken Pediatrics of Oviedo withdrew healthcare services for my 7-year-old, who was a newborn at the time, because we chose not to vaccinate him. Originally, my husband and I decided that we would do a delayed schedule, but the pediatricians at Interlaken said that we had to do the delayed vaccines on their approved delayed schedule. We as parents had zero choice as to how many, when, or even what vaccines were given, even under the delayed schedule. When we decided not to do any vaccines, my son was discharged from their healthcare services because they told me if he was unvaccinated, they would not treat him whatsoever. Even if he had a cold, a bump on the head, anything. In order to remain a patient, he had to be fully vaccinated. My husband and I felt bullied, and we decided not to vaccinate. We decided to seek healthcare elsewhere. I spent several days calling different pediatric doctor offices, trying to find a provider that would take my son since he was unvaccinated. I was unable to find any pediatricians in my city or surrounding cities that would take him. I ended up finding a pediatric doctor who owned his own practice out of Maitland, Florida, who would treat my son unvaccinated. And this was an hour away from our home. In June of 2025, my husband and I moved to Hastings, Florida, and we once again began the search for a pediatrician that would take our sons who were unvaccinated. I called several pediatric offices in several cities and kept being told that if my sons were not fully vaccinated, they would not accept them as patients. I was finally able to find a practice out of St. Augustine that will see and treat my unvaccinated sons.
So my daughter, we stopped vaccinating her around 2 during COVID. This is years ago. We started in Orlando. We were refused to be seen by pediatricians all over Orlando. It was like impossible. We were ending up just going to urgent care. Then we moved to Fort Pierce. Really couldn't find anyone. We were lucky to find one doctor, but then we moved again to Hardee County. And once again, struggling to find a pediatrician that would see my daughter. It's an all over Florida problem, or I'd say all over the country at this point, that you cannot be seen. They won't see your child if they're sick or if they're hurt. You need to be going to urgent care or the emergency room. I recently had my son at home. We left the medical community and decided to do a home birth. We haven't vaccinated him at all. But ultimately, this is a huge problem, not just in Florida, but all over the country, that you are not able to be seen for medical care. You have no medical freedom. You're going to get vaccinated or you're not going to be taken care of. And that's just how it is.
And these are pediatricians that you're bringing them children that were on a delayed schedule and they were still refusing?
Yes, you have to be vaccinated on their schedule or nothing. There's no way about it.
My name is Carrie Gann. I am a mother of 3. My children's ages are 9, 8, and 5. I live in Santa Rosa County, Florida, and I was recently discharged from our pediatrician's office that we have been with for the past 6 years because I asked if my 5-year-old could not have the DTaP vaccine. I had a severe reaction to pertussis and developed encephalitis when I was a baby, and my older 2 children both had a severe reaction, which were both reported to the vaccine injury hotline, and they told me that it was non-negotiable. They would not even talk to me. And then a month later, I received a letter in the mail stating that they would no longer see any of my children, even the 2 fully vaccinated older ones, because I was not wanting to do just that one vaccine on my 5-year-old.